all seizures convulsive?
That's a great question. There's many different types of seizures. What we mean by convulsion or convulsive is a movement in a patient or in a child. So that could be jerking of one arm, both arms, arms and legs, movement of the head, stiffening of the limbs. So it could be really any muscle contraction. It would be a good way to think about it. So stiffening or movement that a child might have in association with an abnormal electrical activity in the brain, meaning a seizure. So there are seizures that don't result in movements of the limbs that we can see, and we call these non-convulsive seizures. These can be changes in behavior. One specific example, a child with temporal lobe seizures, or seizures that come from the area of the brain here by the ear, the temporal lobe, which is a common place for seizures to come from, can have a change in behavior or just staring and a lapse of consciousness. Another type of seizure that's common in children is something called absence seizure, which would usually just be staring for 5-10 seconds. There might be some eye fluttering or other movements associated with it, but it could be just stop what you're doing for 5 seconds and go back to it. So again, another type of non-convulsive seizure.